daughters, sons, sisters, uncles, grandmothers. It's encompassing of everybody who's involved, and it's not just that one person. We worked with Kevin Reese, director for Until We Are All Free, as well as the Bridge Network. And so we connected together with Sadio as well, my research partner. And together we came up with this research topic in terms of figuring out what communities need and how do we document grief, how do we document the economic disparities that happen when a loved one is incarcerated. And of course, Sadio, you can jump in here as well if there's anything that I did end up missing. But yeah.
Yeah, hello everyone. My name is Sadio Jama and I use the pronoun she, her, hers. As Sarai mentioned, this is a collaborative interdisciplinary study that we're doing. And one of the ways that we're doing that is looking at it through two phenomena. So an economic component and a sociological, and it's grounded in ethnographic studies. So one of the ways that we are conducting our findings and gathering our data is by interviewing people in the community. So formerly incarcerated people that we are being connected through by Kevin Reese, as Sarai mentioned. And really what we hope to do is just give a holistic view of what's happening in communities and the cruel reality that stemmed from mass incarceration. Because oftentimes when we talk about mass incarceration, it's from a very individualistic perspective, like this individual committed the crime and they, deal with the consequences. But what we don't recognize is that that person is attached to so many people like you and I are, right? We have families, we have communities that we're a part of, and they are also, being impacted by what's happening. So we really got together and did this research so we can highlight that because it's something so prevalent in our community.
Thanks, Sadio and Soraya. Keita, I don't know if you want to go next.
Yes, that's fine. So my name is Keita Lewis. As mentioned, I am a graduate student. I am in my final year of grad school at the University of Minnesota. So my research project is in partnership with Minnesota Department of Health. So my preceptor with MDH actually proposed a project to me looking at how we share public health data in ways that spur actionable change, and then looking at also how we share that data in ways that doesn't traumatize or re-traumatize marginalized communities. So I took this project on. It's a qualitative research study. I interviewed people who are currently in the role of collecting data, so people at the state level, local level, and community level, and had a conversation with them about ways that they share their data and how they work with whoever their partners is or however they present that data to their target audience that actually works in a way that can create sustainable change, and then propose to them as well as how do they look at that data and share that data in ways that we really look at the impact that it has on the community and what that partnership is with that community whom we're going in there and taking that data from. So, yeah.
Thanks, Keita. Go ahead, Ray. Or Rai, excuse me.
No, thank you. So hi, everyone. Good afternoon. My name is Rai. I just graduated from Hamline University. I studied public health and political science. And my research project was actually the product of about a year's worth of research as a part of my departmental honors thesis. It was actually a dual department honors because I was both a public health and political science major. And for me, the two majors actually seemed very interconnected in ways that I didn't see fully appreciated individually, which is why my research project is really the juncture of that. So my research project was I studied the political determinants of health. I also did this research in partnership with the Minnesota Department of Health. I also received funding from the Region V Training Center, who receives funding from the United States Department of Health and Human Services. I interviewed 13 people who work in public health broadly. So I understood this to be, folks who work in, more of the traditional community-based public health work, but also people who are elected officials and who serve on the Health and Human Services Committee, people who work in the private sector, people who work in the public sector, people who work in nonprofit. And after in these interviews, the questions that I would ask revolved around how does public health operate and relate to policy and politics and ideology, and how do these things shape how public health is conducted, and how does this impact community? So, I'll share a little bit more about like my findings from this research, but what I did, like one of my initial reasons why I knew that I had to do this was because people weren't asking the questions around how policy and politics impacts health. We always talked about the social determinants of health in public health, and I know a lot of you on this call are probably very familiar with this term, but I got to a point where I'm like, the social determinants of health didn't appear out of nowhere. What are the root causes, and how can I engage community? How can I conduct interviews in a way that's able to reveal the root causes of health and of illness in our society?
Thanks, Rai. So, Rai, you just kind of touched on this a little bit, and I know some of you also did in your intros. But just wondering, why did you select your research project, and how did your identity and background as young Black women influence your research questions?
I can start. So for myself, it was honestly Sadio. Sadio, she's my best friend, love her to death. And I remember our sophomore year of college, we took intro to social justice and we did a project together. And we realized that we work really well with each other, and particularly being that this project in this intro class surrounded Black pride and Black power. When we did our presentation in the class, we were like, oh my gosh, we actually work really well together. Come down the line about a year later, she's like, so I want to do research. And I've known she's wanted to do research for a really long time. But I didn't know that she was like really ready to do it. And she was like, you know what, I want you to be a part of it. Let's brainstorm together, see what we, create. She was like, I want to do research surrounding mass incarceration, but I don't know what. And so I realized that my love for community comes from a place of empathy and wanting to understand and be human with one another. And so being that my background was in sociology, hers was in economics, we're like, let's see if we can make this work for our majors, to get our points to graduate, but also just in general to make sure that we're putting work in with our majors. But yeah, from the connection with Sadio is how it came about. We both really felt a yearning, and we felt like there was a missing piece in understanding mass incarceration, and what that means for a community and what that means for somebody who's already marginalized as it is. So yeah, it was just through that. I'm sure Sadio could add more to it, but essentially it was just based out of my relationship with Sadio that it came about this way.
Yeah, I can jump in next. So I've been wanting to do research for quite a while because throughout high school, I just saw the effects of incarceration on my classmates and how it affected their abilities to be in class and be present at school because they were dealing with so much of their family members who were in and out of the criminal justice system. And I just saw this like ripple effect occurring. And I was like, well, someone is not really looking at this from a community standpoint. We're really looking at this from, as I mentioned earlier, from an individual perspective. So from then on, I took classes surrounding social justice and roles in conflict. And I really just started to intertwine my economic minor into this because I wanted to examine it from a very financial perspective and the burden that it has on families. So from then on, we got connected with Kevin Rees, and he kind of coined the term community incarceration. So he kind of put together this big idea that I had and really brought it down to something tangible that we can study. From then on, Soraya was recruited because she had a background in sociology. And then we kind of just put together this research. And it was a year and a half in the making before we actually started conducting anything, or we started to really reach out to Until We're All Free and the Bridge Network as our collaborators. So it took a while to put together, and that's something I've learned through doing research, is that it's kind of up and down. You kind of never know what you're getting yourself into, and you kind of have to go with the flow. So that's kind of where this idea stemmed from. And then from there on, as a Black woman, I was like, yeah, there's not a lot of us doing research out here, and academia doesn't really recognize our work to the extent that our white counterparts are. So that kind of also fueled my inspiration and passion for this.
I can jump in next. So as I stated earlier, so my project was proposed to me by Jeanette Raymond, who I'm in partnership with MDH, but I decided to take on this project because it aligned with already kind of the things that I was doing in the community and my beliefs and thoughts. So I have an undergraduate in public health and sociology from St. Kate's. And as mentioned, I'm in grad school pursuing my public health master's. And I always felt like everything I'm learning and pulling in, you see a lot of data around social determinants of health or disparities, health disparities, racial equity disparities, but there's never any real, I believe, sustainable change or any action happening. So you're always presented with the deficits, but never what's being done to really make a change in that community, or how are we sustaining these programs and initiatives and legislation that's being implemented to change. And so as a stakeholder as well, so as I identify as an African-American woman, I identify as a person part of a marginalized community, I identify as someone of a certain socioeconomic status. I still live in a community that I grew up in. And so being a part of this community and then being presented with information that shows, well, these are the deficits, these are the disparities that's happening in your community, but you never see, well, what's the change? And you might hear about a program, but a year, 2 years later, that program's been defunded, it's gone away. You might hear about legislation being proposed at the state level or the federal level, but then you never see that trickle down effect. And then you'll have people coming in kind of trying to recruit you for different focus groups and fill out different surveys, and it kind of gets to the point of, well, what's the point of this? What's the change? And that helps create the mistrust that already communities have when it comes to public health officials. Or any elected official for that matter. And so I really, when it was proposed to me, I thought it was really interesting and something, again, that I really wanted to dig deep in to see where's the disconnect. Why is it that we are constantly collecting this data? We have so much information. We know so much about how these determinants of health are impacting communities, but at the same time, there's no structural system in place to make sure that the change that we're trying to make, the interventions that are being proposed are sustainable. It's always you're kind of starting back at point one, you're going back to these communities, you're extracting this data for a project or for, to support some type of legislation, but then there's no trickle down effects when it comes to change. And then that is very traumatizing to communities. Not only does it build the mistrust, but then also communities don't believe what you're saying or can kind of rely on you for that information or that it's true, because there's a disconnect there. So that's why I took on this project. I'm very passionate about it. Like I said, it aligns with who I am who I identify as a woman and as an individual, but then also it aligns with my interest to make sure that my goal is to help eliminate racial equity disparities. And so in order to do that, we have to really look at these systems and see where are the gaps and where are we falling short, and how can we bridge the gaps, and how can we make sure that that we're making change that's sustainable and that involves the community.
Thank you for that, Kita. I just can't help but notice, but like the fact that we are all Black women greatly influences our research. And it isn't something, we're not doing research only because like we're intellectually interested in it, or it's something that we're curious about, but because our perspective and our position as Black women in America pushes us to ask questions that are not being asked, pushes us to research things that are not being researched, which is like why I did the research that I did. So I originally actually started as a pre-med-ish minor. I took chemistry and bio, and I took a public health course. And that was the first course that truly highlighted for me the experiences that I face as the daughter of immigrants as a first generation student, and some of the things that I saw in my community that were more closely related with public health. And then within my public health courses, I took a political science course, and I took it because, you know, policy is something that I've always been interested in, but it's always kind of been this mystical, you know, thing that I didn't understand at first. I knew it impacted my life. I'm the daughter of immigrants. The law and policy most definitely impact our life day to day. But it was something that was just so obscure. I'm like, I don't know how I can engage. So I took my first political science course, it was the fall of my sophomore year. And it was American Government Politics, a pretty traditional political science course. But my professor did such a good job of, you know, taking a step back from American government politics and zooming out and focusing our class on not just, you know, our political institutions and what, you know, democracy means in general, but power. We studied power in my American government and politics class. And how this connected with public health for me is that how we leverage power and how we are able to manipulate power is how we can build community power, and how we can build communities' ability to, you know, to advocate for the policies that they need that eventually then, you know, protect public health. So on this journey, I took a poli-sci research class, and it was in that class where I actually came across for the first time the word political determinants of health. And funny thing is, it was actually on a medical blog that a doctor from Georgetown had written. And for her, it was kind of like from a place of exhaustion, like, I'm tired of patients coming in with very similar causes. And a lot of the root causes of the reason why patients are coming in her hospital room weren't things that she could address. The fact that her patients were living in communities that were heavily polluted, the fact that they were working low-wage jobs that were, you know, where they're struggling getting unionized, whether it was they were living in communities that didn't have fully functioning grocery stores. All of these things were beyond the purview of her as a doctor. So she wrote this blog. It isn't a peer-reviewed like academic journal. It wasn't anything like that. It was just a blog. From that, I'm like, I need to know more about this, which is what really catapulted me into doing much deeper research. And what I found out is that, one, we're not talking about the political determinants of health in public health, which I think is a huge problem, because part of the reason is the social determinants of health in public health has become so overused that it obscures why the social determinants of health exist in the first place, right? And like a very specific example is that in public health, sometimes we refer to race as a risk factor, when in reality, it's actually racism that's the risk factor. My race as a Black, like as being Black isn't a risk factor. Being Black in a racist society is a risk factor. So racism is the risk, and then the indicator is race. Being a woman, being a woman is not a risk factor, but because we live in a sexist society, that's the risk factor. So and again, this connects with the political determinants of health, because all of the parts of our society that, you know, make it what it is heavily influenced in what gets listened to at the legislature and what doesn't get listened to. So all of these questions for me came together in studying the political determinants of health. And I'll talk about my research a little bit later, but really, like, the main finding from my research is that health is political, and we need to talk about it as such.
Thank you all for that response. Kita, I think something you said resonated with me, just like being in academia myself at a point in my life, you know, just recognizing that a lot of the research on our communities is almost like another like extraction and exploitation without, you know, any response to that. You know, it's what's done with the research, what's like admiring the problem versus doing anything about that. I'm just curious, and after hearing, I'm just curious how you or everyone on this panel might feel about your role as being kind of in the middle of that. You know, as you kind of weigh out what happens to your research afterwards, and I guess to the communities that are maybe to some degree a subject of your research.
Okay, so how I feel, my role in the middle. So I have I feel like I have really big aspirations for my research. So it's not just, I'm not just doing this for MDH, but I'm also working with Region 5. I got a scholarship through them, which is through the federal government as well, to do this research. And then this is also going to be my master's project. So I'm continuing to build on this to make it even greater than what it currently is. And so my ultimate goal is to really look at how to start some way to develop a sustainable system of this is, or a framework of this is how we approach the collection of data. This is how we share data in ways that can kind of make it more actionable. This is what the follow-up is. This is who we hold accountable when we don't see change happening from this data that we're collecting. This is how we build on what we already know instead of continuously going back into these communities and extracting the exact same data, which we know isn't going to change for a number of factors. And then this is how we work in collaboration with the community. And when I think of community, I'm not necessarily thinking of like community leaders, because not all communities have like official community leaders. Unfortunately, not all communities are represented in that way. So how can we work with community? And I mean by how can we work with my neighbor, the people down the street, like really those who are really impacted, and not those community leaders, because it also acknowledging that it takes an amount of privilege to be even considered a community leader, and how disparities and things are impacting them is different than it's impacting the person down the street, the person who really needs that support and that intervention. So then also looking at how can we reach them and collaborate with that individual to really make change that, again, is sustainable and that's continually progressing and not regressing. So how I feel, just kind of, maybe you were hinting at this, when I look at this data collected when I'm in school or when I'm reading an article or doing anything, it's like, well, wow, that's a representation of me. I'm a part of that community, or that's a representation of someone I know who's a part of that community. So I look at everything on a more personal level because I can tie it into someone I know or someone, a friend of a friend. So everything to me can be tied into a personal level, which is why, again, I'm more passionate about it. I see me in that data. I see my family. I see my friends. I see, my children. So that all that ties in, it only kind of pushes that needle further for me to kind of really pursue this and really look at how can we make sustainable change, and how can we really connect the community, involve the community with that, and what does the community want? Not just presenting them with these, these are the disparities, this is what's going on, but how can we really listen to them and see what they need, and how it's going to benefit them, and how can we collaborate and make things more beneficial? Because like I said, I've lived in a certain community all my life and nothing has changed. I can tell you nothing has changed for the people I know. Nothing really has changed, but then I can read articles and read all of this data, but I don't see, again, that trickle down effect. So yeah, so that's how it impacts me, and that's my aspirations for the future when it comes to this project. So I really hope to, again, have something more formal in place, and I'll keep pushing for that as I go along and kind of build on the data and the literature to support what I am trying to create. So I hope that answered your question.
If I could just hop in, thank you for that, because you did mention it's important to also hold people accountable. Like in my approach, like I often see like research is the first step, and then we need to get it done. We need to get the work done. So how I personally approach holding people accountable, it's the reason why I do my work right now. Often people are like, you studied public health and now you work with Ignite National. It's a political organization that trains women to run for office. And for me, I'm like, yeah, because this is also what we need to do. We need to build community power so that communities can hold people accountable. So when we do have research that's getting conducted on our communities, I want to build the political power of the people in that community to demand that the product of that research will impact them positively, to demand that they have elected officials that care, elected officials that are not worried about re-election rather than actually committing to the causes that got them to run in the first place. And if they are not abiding by that, replacing them with people from our community, which is like, for me, it just seems like a natural extension of my work with, public health and political science and building community power. For me, obviously the personal is political and health is political. I don't have an option but to not be involved in those conversations.
So feel free to jump back into any of the previous questions that we threw out there earlier. But just to pose this as just thinking about while you all were or are in the midst of research, how do you think your identity contributes to challenges or opportunities that you experience as you conduct the research? And I know some of you have touched on this already, but.
Yeah, I can jump in. I think being a Black woman just navigating academia and like predominantly white institutions has its own set of challenges. And then having to conduct research looking at very vulnerable communities through a white institution as well is very challenging. But I think a big part that made this research challenging in terms of like this past summer was the uprising that happened. And as a Black woman studying a Black community and communities of color that are being impacted by this, I can't separate my identity from what's transpiring in the world. So that was very difficult and emotionally taxing for both Soraya and I this summer. And then having to pivot and adapt because you have to kind of continue with your research because in some way it's going to help the community. And one of the ways that we try to be tangible with it is providing resources. And the only way we can do that is by conducting these research, find our findings, and then pass it on to elected officials and put pressure on them to really, provide these communities with adequate resources that are going to uplift them in the long run. So this summer was quite difficult and wasn't something that we expected. But of course, with COVID and the implications of that as well made it challenging. But for me, it was, as a Black woman, I felt comfortable being in my community. Like, these people are not people I'm studying, but studying with. And that's a huge difference compared to, maybe non-Black scholars who do this kind of research.
Yeah, absolutely. More so about building community and creating relationships. I think one of the hard things about at least the beginnings of our research was COVID for one, but our research is embedded in ethnographic methods of research studying. And so a lot of that comes with having to build relationships with one another and being there in community with one another. And one of the hard things was like COVID. Granted, I mean, there were still gatherings and stuff that happened together, which was amazing to be a part of. But at other times, like, gatherings were shut down because of COVID regulations. And it was like, well, how are we supposed to do this and build relationships with one another? Because we don't want to be invasive. One of the main things for us was like, we're asking people to be vulnerable. We're asking people to speak about their loved ones and the trauma that they went through. And that's not an easy conversation to have with somebody they literally just met. And so having to rely on those relationships that Kevin built with the Bridge Network community really was something that we had to hold on to, which was harder for me because I'm definitely a person who like wants to meet the people, and I want to see who I'm communicating with. I want to see who I'm doing research with. But with COVID, it was like, okay, I have to rely on these relationships that Kevin has already built. These people don't necessarily know me. And so I'm going to cross and hope my fingers that they're still going to be willing to have a vulnerable conversation with me. And so that was like the hardest thing, because again, what I never want to do is be invasive. I think for both me and Sadio, that was like the main thing. We don't want to be invasive in a time where issues are already being exacerbated due to COVID. So it was like, how do we balance phone interviews and video conversations, with also building a kind of relationship that can last not just a couple months, but maybe years down the line, because this is not work that I find that I'm just going to stop doing when I graduate from college. Like, this is something that I plan to continue for the rest of my life. And I think I can say that for Sadio as well, because this is a passion that I have for community, for people. That honestly have the wits and have the means to be able to get what they need, but it's like, there's so much political uh, avenues that get in the way of being able to meet the needs of a community that's already been deemed vulnerable. So I think that was like the main challenge for me as a researcher.
So I'll hop in. So my challenges as a researcher, I feel like there were many, both personal and professional. I would say one of the main challenges is doing this type of research study is something that was new to me. So in the midst of COVID, kind of trying to reach out and get the support while figuring out how to navigate this and conduct this research and really put it together in a clear and concise way so that it can be effective. Um, was hard due to COVID because people's schedule changed, life changed for people really abruptly. So it was hard to connect with people and have those conversations and get that support. And I'm someone who prefers that connection, that in person, that connection, that one on one conversation to help better my understanding and build rapport. So doing it online and trying to build those connections or even do my interviews where it was really hard due to COVID because so many people's life, again, just changed unexpectedly. So a lot of people were dropping out and unable to do interviews with me or, not able to use the system that I'm familiar with so that we can do the interview. Like just a lot of things presented itself due to COVID. Um, I would also say that one of the opportunities coming from just the George Floyd, Breonna Taylor situation, all that spotlight on social injustices that communities of color face at the hands of police, that that attention, while tragic, I also realized in my interviews, got people to look at, again, communities and how communities are being traumatized by by police, by public health officials, by um, legislators. Like it really opened people up and kind of sparked their interest more so in my topic, I felt. Because when I presented that, they were most people were, even if they couldn't present an answer of how they're doing that to make sure how they're doing the work of not re-traumatizing or traumatizing communities, they were open to at least have the conversation because they had been so exposed now, like maybe not in the past, to what's really happening in these communities and how these social injustices and how that ties to um, disparities. Uh, so making the connection between that and also making the connection between COVID and how COVID is disproportionately impacting communities of color. People were now more exposed to that. It was all over the media. People are talking about it more. So I think it helped open eyes and allowed me to have better conversations with people. So that was an opportunity that unfortunately came out of a tragic events and things that are happening day to day that are just now being shed light on for certain people, because a lot of the people that I interviewed were actually all but one person I interviewed was white, not from the communities which are stakeholders in what's going on, and kind of really detached. So having that conversation now that is put kind of to their forefront in their face, I think that was a really great opportunity. And then it was also a great opportunity to propose structural changes during that time, due to now now entities want to kind of acknowledge like Juneteenth and kind of acknowledge social justice and kind of be on that train. So it's also a perfect time to kind of propose to people, well, like what structural changes are you doing within your agency or can you do that would help support communities or really help start dismantling these systems that are in place that are not really doing what they need to do, that are not really helping dismantle the system, help making change, not being effective. So it also opened up that line of discussion of how can we do this work on not just an individual level, but on a structural level as well.
For me, my research was with people who held some type of significant amount of power. I talked with elected officials, commissioners of entire agencies. So my research, like very different from everyone else, was, you know, I was actually walking into the room with significantly less power relatively than to the people that I was talking with. So oftentimes it's like this really uncomfortable dance of like how me as a Black woman walking into an elected official's office and asking them questions is kind of like, who are you? What's your authority on this subject? What are you going to tell me that I don't already know? It was that kind of thing for some. And then for others, it was a genuine, you know, like some of the people that I talked with is certainly, it was like, I am so interested in what you're looking to get out of this research project. And I'm like, I want to contribute. So it was definitely like a mix of both. But I will say, you know, especially after what Kita, you just mentioned, like around all of the events that happened after this summer, I can't help but wonder if I did my research project again, I wonder what kind of responses I would get. I think this summer has, if they weren't already aware, I think this summer, illuminated exactly how deep, racism and sexism and all of the isms together are in this country. You know, this isn't, I always say, like, George Floyd wasn't the beginning of racism, and George Floyd was the moment that our communities simply can't handle anymore. George Floyd was not the only one, and George Floyd, unfortunately, will not be the last, and obviously, as we've seen, has not been the last. So I wonder if I asked the same questions that I asked before and now, if their responses in terms of bringing about structural change would be different. I would hope that they would be different, but I do know that, like, prior to the era that we're in now, a lot of people's proposals and, diversity and equity was very bare minimum. Like, we were talking very little changes and not the real transformational type of change that we need. And I wonder if events after this summer would have changed people's perspective to come up with something more bold, that takes into account what community has been saying for a long time, because we know that the solutions to these problems aren't unknown. They've been researched, they've been studied, communities have been advocating. These aren't things that they haven't known, but I wonder if the current era that we're in, if I ask these questions, if their answers would change.
Just looking at the chat, and there's a question that's super relevant to the conversation that's going on right now. I'm wondering, someone put in the chat, like, do you feel traditional research methods fit with your research topics and populations, or did they restrain you? I'm curious if you all have anything specific to share about the methodologies you chose, or how you've had to kind of like be innovative in your methods and approach to be able to do the research in a way that you felt was more appropriate or equitable or ethical.
I can just say something briefly too. I didn't research. Methodology in general is a really complicated topic, especially when you're researching with marginalized communities. And oftentimes, you're right, methodology can be constraining. And the way that methodology is framed actually doesn't allow you to capture what participants actually want to say. This isn't the research that I did for the purposes of this talk, but in previous research, I've done community-based participatory research that allows participants to also dictate the conversation on what should be researched and what the products of that research will be. Another methodology that I've used before is photo voice. And photo voice is a social justice methodology that allows participants to actually take photos and then submit those photos and explain why those photos demonstrate a question that we ask for them. So it actually puts the power in the hand of the participant, in the hands of the community, to determine and define what does that mean for them. And oftentimes more structured approaches doesn't allow for the fluidity of which is people's lives. And like personally, and this is like heavily debated in journal articles, but personally I'm a lot less lax on methodology, and I tend to be a lot more in favor of how did you adjust and adapt your research methodology to what communities are telling you to do. If community is if like I'm in an interview and a participant is responding to things that may not be what I expected to hear from, I'm gonna adjust. Why? Because they're telling me to adjust. And the reason is you capture responses that you otherwise wouldn't have if you just stick to what you had on paper. So.
Right, what you just explained is precisely what we're doing with our research, and giving the power back to the people that we're studying. And one of the ways that we're doing that is giving them full agency and autonomy about whatever they want to talk about and just going with the flow from there. Because like you said, there's so many unheard narratives that can come up by just, not sticking to the script necessarily. And that's one of the ways that like we hope to really draw out the themes that we are searching for, is by giving people space to talk about whatever they want to talk about. But in terms of methodology, we are also doing ethnographic study work. So we are conducting interviews. We are also doing participatory observation and really immersing ourselves with the community. That's such a huge part of it, because as we all talked about earlier, we don't want to be invasive and just kind of go in, collect the data that we need and dip, because that's re-traumatizing. So we really just want to make sure that we are having all the safeguards in place so that we are doing it in a very ethical manner. And just giving people the right to kind of say whatever they want is really the essence of our research and our data collection. So.
Yeah, I mean, I think too, because one of the theories that we're using is ambiguous loss, which is like this notion of losing someone, knowing where they're located, and like knowing that they exist and that they're here and alive, but not really sure where they are. And so one of the things is like, just like Sadia was saying, is allowing people to just speak from wherever they are at, due to the fact that, for one, we're not sure how ambiguous loss is going to show up. We're not sure how people are going to talk about their loss. And we're not sure of really what to expect. So I think part of it is that we have to be prepared to adjust. We have to be prepared to move with what people need, because a lot of the time we forget, or not that we forget, but we never ask the communities what they need. And that's one of the number one things that I think our research responds to is creating a list of needs for a community that has never been asked that question. And how do we support this community in using what we find, the data and what we find from our research, to put back to the community. Another thing too is that we've given people access to their transcripts. I feel like that's something that doesn't happen. The people that we do interview get their interview back and get their transcripts back as well, so that they have access to that. Whether they decide to use it elsewhere, that's up to them, but that's all, they have full agency as to what they decide to do with that. And I think that gives a little more freedom for both of us, both the interviewee and the interviewer, in this process of building relationships, because at the end of the day, that's what our goal is to do.
So my research, so it's a qualitative inductive study where I was interviewing individuals who are currently in the role of collecting public health data and sharing that data. So not working directly with the community, but the person who is doing that work, to get their perspective on where the gaps are and what the opportunities are, and what systems are currently set in place, just to kind of look at a proposal on how to change that system or improve it. So, I mean, I would have loved to do a second part add on to where I'd be talking to people in the community about how they feel about the research being done on them and how they feel about researchers coming in and those collaborations. But unfortunately, due to time constraints, I was not able to do that. The opportunity just wasn't there, but I would love to do that, something like that in the future, just to really hear from community and their perspective uh, on that. But yeah, so I'm so sorry. I forgot half of the question, Zachary.
We're just talking about research methods and whether or not they're inclusive to the way you really need to go about your research.
I thought it was inclusive to the way I needed to go about my research. I had a lot of very interviews started off as formal, but kind of in the midst of conversation became informal, and I prefer informal conversation because I find that people are more open and honest about how they feel about things versus, you know, you're just asking them a bunch of questions, they're giving you really generic answers or quick answers. But by being informal and creating an atmosphere where we're really talking about the topic, and of course, different things that they say will tie into the questions that I was asking of them, but I really got to hear their true perspective and what they really thought by having an informal conversation. Um, my interviews went from initially being maybe 30 minutes long to one interview was almost hour and 45 minutes because we were so deep into the discussion and just how everything ties together. So I think my methodology of informal interviews with that, but having some type of structure in place really worked out well for me.
So let me just ask, we talked a little bit about this earlier, kind of swinging back around to it more specifically, but how do you hope your research will be used in the future? What makes you excited about this opportunity and what makes you cautious or anxious?
Well, for our research, we hope to really put together a final report that details what we've been talking about and what communities have been facing and the cruel reality of mass incarceration and community incarceration for that matter. And we really want to share that findings with the community that we're studying because we want our things to be accessible as possible. So giving members of our community the information that we found and how they can use that to mobilize within their family structures or their community structures. But another big component of that, and I think Rai had mentioned this earlier, is policy plays a huge role in societal issues. And a lot of these issues are created by policy. And those are things that we can change and eradicate and, make difference through. So we hope to share this with elected officials to create substantial policies that fund communities the adequate resources that they need and uplift communities out of the issues that they are in. And we plan to do that as soon as we really finish our research because we understand how serious of an issue this is and how for so long communities have been, dealing with these issues. So we really want to put together the necessary resources to address this in a manner that's also systemic and not just conversational, because we can do research all the time and we can study these same issues over and over again, but if nothing good comes from it, then there's no point in doing it. So that's kind of what our direction is going forward, is to connect with our elected officials and our community leaders and say, hey, this is what we found. These are the resources that communities need. How can we come together and help them in a way that's not invasive, but sustainable? So.
Anyone else want to share?
I would say my hope for my research as I build on it is to, in the short term, create recommendations or promising practices that state, local, and community health professionals can use when they are sharing data with whoever their audience may be, in ways that again will lead to really sustainable and actionable change, but then also hoping to create some type of sustainable framework that can be used in the future going forward on this is the process of how we this is how we collect the data, this is how we share the data, this is how we make sure that we are not re-traumatizing communities. This is how we collaborate communities. And this is how we move forward when it comes to pursuing change in legislation. And then this is how, this is how we make things just more sustainable and dismantle these systems. So then this is how we change the structural setup that's in place that has not been effective. So that is my long-term goal, to kind of come up with that framework of what people can use.
And for me, it's really that I want to push explicit about how power, politics, and ideology impact health. We need to be very explicit that health is not due to moral failures or the choices of the individual. Has real consequences, and also has root causes that we can better work to address by positioning ourselves as public health advocates, as health equity advocates, to be better protectors and better people to empower our communities to demand better. Yeah.
I think too, the hope with the research that Sadio and I continue to do is to provide the Bridge Network with some sort of assessment as to how it's providing for its community. Then that way, when the Bridge Network decides to seek for any sort of grant or whatever that may be, they have an assessment to say this is what's been working and this is how it's been working for the betterment of the community. But yeah, like there's definitely a lot of policy change. I think one of the things for Sadio and I is big on policy change, because things won't get moving not unless politics is involved. And as very much as my skin is political, it only makes sense that the work that is done is also political. So yeah.
I appreciate that. Just turning to some questions from the chat. It was asked, when creating your research agreements and or MOUs, memorandums of understanding, as you prepare to engage with different communities or extract data, who do you invite to that table to set the terms of engagement? And which key stakeholders do you think are often overlooked?
When we were creating our interview form, I guess, one of the things that we wanted to make sure that we were communicating was that you have access to everything that we converse about. And we wanted to make sure that Kevin was at the table when we created this form. We wanted to make sure that he was seeing what we were creating, but also because he's our informant, we thought because he has the best knowledge concerning the Bridge Network and the people that we'll be communicating with and hopefully building relationships with, that he'd be a part of how we set standards, but also because he's a collaborator, it only made sense that he'd be a part of it as well. I think a lot of the time when we create like MOUs or interview requirements and things like that, a lot of the times I feel like we forget about the community that we're actually interviewing. We don't invite them to the table. We don't ask them to be a part of, well, what do you guys need from us too as researchers? A lot of the time it's, okay, well, as researchers, what do we need from you? And never that conversation back. So I think in terms of moving forward, or at least in terms of this question, it's important that we bring the people who we're asking to give to also be a part of how we create standards for one another, to hold each other accountable in the process, because I feel like that gets missed a lot of the time. So
So just another question from the chat. Maybe Kita, you might take the first stab at this one. This is some of the things that you've been touching on in some of your responses more directly. But what was shared was systems use research data to make decisions. How do we know when systems are serious about sharing power with community? And what does that look like from your perspectives?
I think that is a great question. I don't know what that would look like at this moment, but I think we would know that systems are serious about sharing power with communities. When you look at things and you hear the community voice more than the system. So when you look at things and it's coming from the perspective of the community and not the system that collected that information. And I think that would be very apparent on how that data is presented. It will be presented in a way that clearly demonstrates this is what the community wants. This is kind of what their needs are. This is their voice. This is where they feel that what their assets are. And this is how we support them. So I think information would be shared in a different way where you could see that it's coming from it's being told from the voice of the community and not that presenter or that system. What that collaboration would look like to come to something like that, I'm not sure. And that is a great question and something that needs to definitely be explored. But I think you'd see data in a ways that clearly highlighted the voices of community and clearly showed that this was what they wanted and that they are the ones holding the power. Versus now, I think, again, things are presented in a way that really just demonstrate the deficits of communities and where we can kind of step in and be its savior versus this is the strengths of these communities and this is how they need the support to continue to strengthen their power and achieve what they need.
This makes me think about Congresswoman Ayanna Pressley's quote that has always stuck with me after I heard it, which is, the people closest to the pain should be closest to the power. And so in response to your question around data collection informed systems, how can we tell if systems are serious enough about this work? It looks like giving up power. It quite frankly means that maybe you need to take a step back and actually allow community members to that table. Community members are going to dictate what they need, when they need it, and how they need it. I think sometimes systems operate in a way that's kind of paternalistic, in the sense that systems determine what communities need, and it's top down. When in reality, the people who are closest to the pain, people who are at the margins of our society, actually know best what they need to be able to live in communities that are thriving. So for me, I can't get into the logistics around what this looks like from a systems perspective, but what I can say that it definitely should and must include relinquishing power and letting communities lead.
I'd like to add, again, when we say communities, talking about the people that it impacts the most and not necessarily community leaders, because I think sometimes when we say community, people automatically revert to who's considered like the community leader. And again, not all communities are fortunate enough to be set up in a way that they have a official leader, someone that speaks to them. Being a part of communities are not monolithic. So when we say listening to communities and giving communities the power, it is giving the people, the day-to-day people, the people who can't necessarily show up for certain things or participating in certain things due to they have to work or family obligations or just different barriers that are put on people that keep them from these tables of power. When we get those people, that's when you can really see change in that community. And that's when you know you're really working with the community to create something that gives them the power versus working with, again, quote unquote, community leaders, because again, that's still part of a system that doesn't necessarily trickle down and really create change and impact the people who are most in need of that support.
That's brilliant. Like that's exactly what needs to happen. And what I've seen, I actually was a legislative intern with the Minnesota Department of Health and Human Services. And oftentimes what they call these community leaders are stakeholders. And we have stakeholder meetings with community leaders who come from and I think part of like the funny thing here is like DHS is like, we're bringing in community. Like, what do you mean we're doing so poorly? But the problem is they're bringing in the same people, like you said, the people that are actually not day-to-day people who live and like breathe in the community, but are actually people who are like maybe like somehow racially or otherwise representative of the community. So they become they are detached from their community, but they're enough of a connection to have them be a community representative or whatever else. So yes, it does look like bringing in day-to-day people, not just community leaders that are easy for you to get in contact with and bring to the table and say, check, we got community.
And just to follow up on that, do you feel like in your research you had the chance to engage with day-to-day people as you should, or just like that identity rather than the community leaders that are probably, or maybe the faces of the community that are already kind of recognized to be at certain system tables anyway? And then maybe I'd ask as a follow-up, like, what's your method of access? Because I think systems that are interested in engaging with community are still learning how best to reach out.
Yeah, I mean, I think in the beginning of our research in terms of like participatory observation, we went to a couple events like of just like Black people getting together. I think there was some things happening on Juneteenth, or like at least the week of Juneteenth. So particularly myself and Sadio, we just went and decided to be with community. There was food, there was talent sharing, people were selling things. It was just like, why not just be in community with one another and share space with one another, eat food, break bread together. And just see what happens. I think a lot of the times, like Black people are really good at being celebratory. We're really good at like having a good time and just celebrating being Black, which is something I'm super proud of. And I, can't take it for granted. And so being in a space like that, it's not hard to come by. I think there are a lot of spaces where Black people get together, and it's just a matter of showing up. I think a lot of the time, sometimes it seems to be that there needs to be an invitation, but I think community involves an understanding to come together as is, and wherever you're at is wherever you're at. I can't remember the second part to your question.
Obviously, you can't unmute with proficiencies, right? Sorry. No, just like if you have any advice for systems that are trying to engage that level of community, how do they get access? What's the best way to get to them and bring them into conversations?
Man, I think when it comes to that, I really think it's a matter of reaching out. I mean, because I don't think communities who are doing the work are not invisible. I think you do see them doing work in the community, particularly like organizations like Until We're All Free or Voices for Racial Justice, the Bridge Network. Yes, these are organizations that like I've worked particularly personally with, but they do exist. And I think it's a matter of just reaching out and being like, we want to be here. We want to be a part of a way to uplift and of a way to bring change to the community. Because that's just one place to start. I'm not saying that this is the answer to all things, but that's one place to start. Because I think at the end of the day, Rai said earlier, like, quite frankly, it might just mean that political leaders have to just give up their power and be with community and say, like, I'm here as well, just like the rest of you. Because I think that's the piece that is always missing for me.
I would say just a thought I had would be engaging with these communities prior to starting any work. So not just engaging with these communities and showing up at these events when you want to build these relationships to benefit you, but engaging with these communities because you want to build authentic relationships. So that way, when it comes time to start those collaborations and bring those people to the table, you've already built that relationship and you've already built that trust where people will be more inclined to participate and really trust that you are there to support them and uplift them and give them the power versus showing up to an event because in 2 months you're going to start this research study or you're trying to get this information, and so you're going to show up and introduce yourself and so that you can get to know some people but not all people and kind of get some people into that conversation. I think it starts with being authentic and really trying to build those relationships, and then I also think it also starts with having people who are, again, stakeholders in that community. And when I say stakeholders, some people who are still living in these communities, still engaged in these activities, people who are already attending these events, organizations that are already doing this work and have those relationships, continuously engaging with those people on a constant basis. Because the thing about public health, everything is interconnected. All of our research projects, though all very different and it's siloed, it's all interconnected. It can all be tied together. So just simply by putting yourself in a place where you're engaging with these communities on a continuous basis, that's going to help support you with whatever you're doing in the long term because everything's connected. And it'll help build those relationships. And that way you can really get to know people, really get to understand what they need and how you can collaborate with them and give them your power and help support them and uplift them so that they are doing the work themselves to improve their communities. So it starts long before the project.
And I would just like quickly add on to that by saying, be very intentional about the connections you make. Don't make it just performative. Do not go into these communities because not knowing anything, because you are going to inflict trauma and re-traumatize them. So really being intentional about why do I want to study this or what can I do to help, and go far beyond monetary donations. I always say that like money helps and money is powerful and it can change a lot of things for a lot of people and it can uplift communities. But if you're only donating once and not really invested in how we got to these issues in the first place and how you as an individual may perpetuate the system, it does no good for no one and it does not help the community that you are intending to help. So far beyond performative allyship, really, really make sure you're cultivating relationships with these communities because they have so much to share and have been sharing for so long. And you are probably just recognizing that their voices are there. And that can sometimes be a little turnoff if you just go into a community expecting to, kind of learn everything. It's like, well, they don't know you like that and they're not going to open up. So intentionality, I think, is a huge part of that. And I'm sure Soraya and Shakita touched on that as well.
And then lastly, I'll just add some of the logistical pieces around this that you could do is maybe instead of having the meeting on like the 6th floor of your agency, maybe it should be at a local library. Maybe it should be at a community center. Maybe it should be at a park. Maybe it shouldn't just be like them coming to you, but like you going to them. Some like general best practices I would say here is making sure people are paid for their time. If they're helping you to do better is really what we're talking about. If they're helping you to do better, that's a job. So that they should be paid for that. Make sure there's childcare. Make sure it's accessible by public transit. Make sure that it's on a time of day that people can attend. And for people that are traveling long distances, because like obviously our agencies that are based in Minneapolis, St. Paul affect our whole state. Maybe we should have hotels for people who are traveling from long distances, so they can participate and maybe not have to drive home late at night. Like all of these things are so important for them to be able to participate. And it allows us to actually get the community members that are not just the leaders and that already get paid to do this, but, people who want to volunteer their time.
So I just want to pose this question. It's curious if this is come up in the work that you all do, but there's been an ongoing conversation in the Black community, especially in the Twin Cities, and kind of like a bit of a separation between American descendants of slaves and first generation immigrant, second generation, et cetera, people that identify or would be identified as Black. And that conversation is like, it hasn't been like resolved yet. So I'm curious if that came up in your research at all. And if you have any ideas on where best to continue that conversation or how to get to resolution.
This is like definitely a very like a pertinent conversation right now in Minnesota, especially Minnesota politics. While I didn't address this in my research, I think part of the problem is that the folks in power don't know the difference. I'm not African American, I'm the daughter of immigrants, and I'm Black, but I'm not African American descendant of slavery. Like and the differences means that the needs of each community is different. That being said, I'm just going to acknowledge in African immigrant communities, there's a lot of anti-Blackness. Folks in African immigrant communities don't identify, or some don't identify as Black, which feeds into, a kind of like horizontal racism that we see in Minnesota, which is very, very real and very valid. I know something that I always talk about in my work is that as someone who immigrated to this country, I wouldn't be here if it wasn't for the civil rights movement and if it wasn't for African American descendants of slavery who set up the foundation for me and my family to come here. Furthermore, it wouldn't have been, none of this would have been possible without that. So I think in the African immigrant community, it's like, I know personally have to work on undoing the anti-Blackness that exists and understanding that our needs are different, but it's also not like pointing fingers, because when we look at the research, African immigrants tend to like generally are a little bit better in terms of like health outcomes than African Americans. And that makes, I'm just being completely honest here, where African immigrants are like, oh, like, why, like we just came here and we're doing so well. How did that, like, what does that mean? And we have to talk about it. Well, the reason is we came at a point, like the race began way long before we got here, right? So when we came, we didn't struggle finding a house mortgage to get our house. That already existed, but that didn't exist out of nowhere. That existed out of years and centuries of trauma and oppression that African Americans had to bear while continuing to fight for justice. Like that, we wouldn't be here if it wasn't for that. So I think sometimes there's a lack of context. And then that's like on the internal level, but on the like external level, in terms of like, how do we approach like systems and how do we, like, what kind of resources do we need? It looks different. African immigrant communities need different resources than African descendants of slavery.
Oh, I wanted you all to, yes, come for it, Keita.
Sorry, I have to wait until my background gets quiet before I unmute myself. I apologize. So as an African American, and I don't consider myself a descendant of slaves, but a descendant of those who were enslaved, because my ancestors were people, unfortunately, who were enslaved. They were not slaves. That was not their identity. There's their circumstances. So I'll start there. And I would say, unfortunately, I wasn't able to touch on this in my research, like at all, looking at that distinction between African American communities and first generation immigrants. But kind of to the points of I was saying earlier, where it's saying that when you talk about communities, certain communities are not set up where they have leaders. I was talking about my community as an African American, like the way we are structured, the way we are set up, our culture, and how we had to develop our own culture and our own ethnicity in America is not set up like maybe some of the people I know, where they have community leaders, they have tradition, they have a certain method of doing things. So their resources and what they need and how you engage with that community is completely different how you would engage with people within my community and where I come from. Because unfortunately, due to just the history and how things have been set up against African Americans in that struggle, we no longer have those official leaders out there that really are engaged in the community and kind of helping us fight. And then we also don't have that structure set up where this is how you engage with us. Being African American, again, is not monolithic. We do not all have the same experience. And then we do not always have the same structural setup. Where engaging with us will be, though, this is how you engage with this community and this is the resources that this community needs. It is not the same. And I know that from just, again, my personal experience and conversation with friends. So yeah. And what was the other part of your question? Sorry.
Yeah, just as this conversation goes on, what should be done to help like promote resolution here and us getting to, I'd say, and by I guess us, I'm referring to Black people in the Twin City space, kind of clarifying what page we're on.
So I also would say that one, recognizing that there is a distinction, there is a difference in history and how how people are impacted, and then why certain people have certain outcomes versus other communities. And then also acknowledging that I think the divisiveness, I think someone said like there's some anti-Blackness or anti-African Americanness in certain communities. The intention of that and who that benefits, that divisiveness and keeping us against each other. Because at the end of the day, we are all people who are experiencing some form of oppression, whether it's due to our gender, whether it's due to our sexual orientation, our abilities, the color of our skin. Yes, it impacts us differently just due to our background, but also at the same time, we are all people encountering a system of oppression. So being really aware of that divisiveness and how it kind of hinders our growth as a whole and how it hinders our improvement as a whole. Because when you improve the health and outcomes of African American individuals or Native Americans, you're improving the health of everyone, because things that impact me also impact you, maybe in a slightly different way, but at the same time, things that will benefit me will also benefit the whole. So being very intentional about learning about who's benefiting from that divisiveness, and then how can we educate ourselves on what that looks like, and be intentional in coming together and being supporting one another, because I don't have to be from your community or identify exactly how you identify as to understand what you're going through, and also collaborate with you to gain power to make change, and understanding we benefit from the healing of all.
I'm gonna keep myself on mute so I can tone down the agreement. I don't know if there was anything else that folks wanted to share about that idea, but there's another question coming through the chat. How can a study that's already running begin to collaborate with community in a respectful way? So thinking about bringing in community while you've already started going down the process.
I think it's important to recognize that there are people doing the work, that whatever you're interested in, there are probably community members that are doing the work or have been. So it's a matter of just going out and finding those people and really connecting with them in an intentional way. And it's not necessarily like you always have to do the work. Sometimes supporting that work can also be an act of resistance and solidarity. So that's what I'm really thinking right now.
In an effort to not say it's too late, I'm going to try to say engage communities intentionally, but be prepared to maybe change research topics, maybe change the question, maybe change your approach. Expect that there's going to be some type of change to what you originally proposed, because what you originally proposed was without community. So yeah, I think it is possible, because, you know, I don't also want you to go through the whole process not having included community, but I do think, like, because you're thinking about community, it would be important to take a pause, engage community, and then reevaluate your next steps.
Okay, thanks for the response to that. I think it's really important for systems in general to be in recognition of the fact that sometimes engaging community means questioning assumptions and restarting in different places you didn't intend on restarting. So another question that was in the chat: how do you think that the review process that journals use to determine acceptance for publication will help or hinder efforts to publish the kind of research that you all are conducting?
I'm sorry, can you say that question one more time? I'm sorry.
Yeah. How do you think that the review processes that journals use to determine acceptance for publication will help or hinder efforts to publish the kind of research that you all are conducting?
So for me, I'm gonna do a shout out to Susie. Susie's my professor. She's been my professor for 4 years when I was in Hamlin, and me and her have worked very closely together in terms of how to turn our radical social justice focused research into publishable articles. So like we've got it down to a science. Just like some general comments that I have is that it matters what journal you select. So if you select a journal that has made it clear that they don't publish research like this, then don't submit. And actually, you don't want to submit there either. One journal that I'm looking at personally for my research is the Critical Journal of Public Health. So they specifically highlight research projects that are critical, that approach public health from a critical lens. So that's a journal that I feel that my research should belong to, and therefore the people that review it are also going to have the same type of lens and approach to it as I am. So I say choose your journal wisely. And then when you are structuring your research, definitely tap into your mentors, your professors, the Susies of your life, to find a way that you can package your research in a way that meets their formatting guidelines, but still is like reflective of what they feature in their journals.
To kind of piggyback on that, so right now I'm working with my academic advisor to, again, formulate my research so that it is clear and concise so that it can be published. And one of the things we were talking about in our last meeting is considering who would accept what I'm creating, who would accept what I'm trying to publish. So again, finding publications that will actually publish your research, and who, because it also, you have to look at who creates these strict guidelines and how they're beneficial, and is it actually a place where you feel like your research would be beneficial, and where is it in a place where people will read it and actually be able to digest and really how do I want to say this, really implement what you are saying and really take that in. So considering where you want to publish your research, and I was having that conversation with my advisor as well, so she's kind of my Susie. So looking at that, and then also, again, just looking at how to structure it in a way that it can be published. I think for me, the struggle will be just due to COVID and everything, not being able to get as many interviews as I had wanted to, and having the time to really take a deeper dive into this. Like I said, I wanted to where I could actually maybe even talk to community members and kind of get their perspective on how the sharing of public health data traumatizes them and what their experiences have been, because I think that that voice would have been very vital to this research. So I think not having a full perspective will hinder it some ways, but at the same time, I think the literature that I'm looking into and how it all interconnects, I think will also be beneficial. And then where I'm looking to publish will be helpful.
Personally, I've yet to publish anything just yet, and hopefully down the line with this particular research with Sadio, hopefully we can publish something. Though the hope would be to be able to connect back to the community that we did research with. not just that, but also make sure that the research is accessible, and however that decides to come out, crossing my fingers that it all works out. But yes, Susie, I see you, you will. Yes, I'm crossing my fingers that it'll happen, that we'll publicize something. But yeah, I definitely want to piggyback off of Keita and making sure that like the research that gets done, or at least the publicizing of the work that is done, requires community to be a part of that as well, and how community has been a part of the work that I've already done in research. How is that going to translate into how people read and how people understand what was created in the process? So
Rai, there's a question I think you might be poised to think about as it relates to some of the social determinants of health. But one of the questions I see here is, how do we challenge the term social determinants of health in our jobs or internships? It's really important to pivot and puts the onus back on politicians and the policies they push.
Yes, I'm glad that you are wanting to do this. That's definitely the first step. I would say, for me, what I find to be useful is like asking questions in meetings. So when people are talking about the social determinants of health, pushing them to dig deeper. And like it actually becomes a lot easier when you really understand that the social determinants of health aren't the end all be all. Like if you ask the question, okay, well, why is it that certain communities live in places that don't have fully stocked grocery stores, live in communities that don't have access to public transit? Like all of these questions, if you just keep asking and you get down to the root causes, like you can't help but like come to the conclusion that this is not natural and this did not happen out of nowhere, but it's actually the product of a series of political decisions that impact people's life. Like sometimes in public health, whenever I say the political determinants of health, they either automatically assume I'm talking about like partisanship, so whether it's like Democrat or Republican, or they assume that I'm only talking about healthcare policy and that kind of thing, and it's not. So this is not. It has actually nothing to do with political partisanship. It has everything to do with the way our political system in general is designed. So people who are in office, people who are elected in political office, have direct power over what resources communities get and what resources communities don't get. And what we need to do as public health is we need to see those as decisions that impact the health of the people that we are trying to protect. As public health people, like I always say, like we are protecting people's health. We are protecting and advancing public health. So if we know that like food deserts, for example, which has actually in recent days been called food apartheid, because that's really what it is, where communities are living in places that literally are deserted of any type of sustainable, affordable, resourceful food options. Is we need to understand that this did not happen out of nowhere, and communities didn't choose to live in these types of circumstances, but the circumstances were politically constructed. So I ask you to definitely ask questions in your meetings. Build your own power within systems, because I know that there are some really good people working within systems that cause a lot of trauma in our communities, and you can't do it alone. So I don't encourage you to go into the meetings and be the only person that's advocating for this, but I say build your power within the folks that are thinking the same ways that you are. And when you go into these meetings, you won't be the only one, but over time it's going to be you and like 5 other people in the department that are like, we need to start talking about this now. And that's how you push systems. It can't just be individuals. It has to be a collective of people coming together to push the conversation forward, because there's no other option. So those are some of my general feedback right now.
I'd like to add that I think language is powerful. So in one of my first meetings with my internship preceptor, Jeanette, instead of using the term social determinants of health, she referred to it as key conditions. And just by simply changing the language and what she used to describe it, it changes the narrative and kind of can change the attitude. Because when you think social determinants of health, some people associate that with individual choices, individual actions that lead to these health outcomes versus these are the key conditions that people are living in that produce these outcomes. And just by changing that language, it helps to kind of change their perspective and really open people up to looking at things from this isn't an individual problem, this is a systemic problem, this is a historical problem. This isn't, determinants of health. This isn't because this individual lives here, this individual does this, but this condition is the individual is dealing with this condition due to this, structural circumstance. So I think language is powerful. So when you are going into these meetings and having these conversations, really think about the language you are using. Again, another thing Jeanette taught me is really, again, not focusing on the deficits of these communities, but presenting things where you're focused on these are the community assets. This is the strength of this community. This is what, despite all adversity, despite all of these things, this is how this community is thriving. This is how they are continuing, to improve. And this is the work they're doing, instead of just looking at it as these are the determinants of their health. And, because they deal with this, and this is going to be their outcome. That isn't necessarily the case. There's a lot of strength there. There's a lot of protective factors there. So the language you use can help dictate the perspective and the narrative you're perpetuating, which can help change these conversations as well.
I just want to say one thing. And this, for some reason, this conversation made me think about the quote by Brian Stevenson, where he says, the opposite of poverty is not wealth, it's justice. And sometimes I feel like wealth is where people resort to when you don't and the problem with that is that you then don't understand how poverty was created. And then that means you don't know the solutions that we need to solve it, right? If you think that wealth is going to be the solution to poverty, then you didn't do your homework. You didn't learn about the history of people who have grown up into societies that literally Black people weren't even considered human at one point in our country. So if we haven't come to that reckoning, and we don't understand how that translates to redlining, and how redlining has translated to gentrification, and how gentrification is now leading to people to be homeless and houseless, well then, like, we didn't do our homework. So that like, I think what Brian Stevenson is trying to get us to think about is that poverty is the solution to poverty cannot be wealth, and it cannot just be grants, and it cannot just be funds. It has to be justice.
Thank you for that important reminder. I really appreciate it. So I think we have time for maybe one more question as this group before we break out into smaller groups. And I think, just thinking back to your research and your experience and where you are now, is there like a call to action you have for students, community members, academics, or professionals that you might want to share with this audience?
My call to action is for students. Hopefully there are students who are watching this, but if you see an injustice and you want to do something about it, go do something about it. There's plenty of people who I'm sure would love to do the work with you. If not, probably already doing the work, but reach out. It's honestly simple as just showing acknowledgement for something that you find that you have interest in. Go for it. It was clear that the George Floyd uprisings, like that was all through people communicating through social media. So if you have if you feel an inkling of any sort, reach out to somebody, whether that's your friends, whether that's something on social media, do something, like put forth your body to it as well, because it's not just like through tweeting and all that stuff, or through like monetarily funding, but it's a matter of actually going out and being part of community and living that and breathing that. So I call you guys to go for it seriously.
Yeah, I would go off of that. My call to action is to donate, not just to organizations that are doing the work, but organizers that are, on the ground, protesting, putting their bodies in front of police, who are doing work that is creating such substantial change that we're seeing. And one organization I really want to highlight for you all is Until We Are All Free. They work directly with incarcerated people to help out with their legal fees, and making sure their families are taken care of. So you can go ahead and check out untilwe'reallfree.org, and you can just kind of read about, the work that they do and how you can donate. But as I mentioned before, like, donations are not enough. So go far beyond that and really invest in why these issues exist to begin with, and really begin to address the ways in which you, in the body that you're in, maybe show up a certain way and do things a certain way. So addressing the core issues, I think, is also very important, and having some sort of intro perspective on how things are the way that they are. But I encourage you all to donate and really just get involved with people who are doing the work.
So my call to action would be for current and rising public health professionals. As you know, a lot of people are retiring out of these positions and new people are coming into these roles. As you enter into these systems, question these systems and think of ways how to dismantle and restructure them so that we are making effective change. Clearly, the old way of doing things, the old way of collecting information, sharing data, engaging with communities, we have learned that it's not effective, it's not working. So as you enter into these roles and you are starting to do this work, start thinking about how can you, again, restructure the system to make it more efficient. How can we, again, be more intentional about these collaborations and start that process immediately, versus kind of getting into the flow of how always doing things, the old way of doing things. Because if you continue to exist and do things the way that we've been doing things, it's never going to lead to any tangible change. You're just going to continue to perpetuate a system that we know doesn't work. So as you're in these roles, or starting to look for jobs and do this type of work, go into these roles with the intention of relooking at a system to how to make it more effective, so that we as professionals are really able to make that change and improve the lives of individuals, which is why I'm in the public health field. So I'm assuming everyone else in that field has that same aspiration. So really be intentional about how can we really make that change and make sure that it's sustainable, not temporary.
My call to action is maybe a little cheesy, but it's like, you have power. You have power, and us collectively, we have even more power. And it's just a matter of leveraging our collective power to uplift truth, and always demand more and demand better, and hand the mic to communities to lead us into the ways that we need to be. For specifically talking to students, take charge of your education is what I say. That's kind of how I approached undergrad. And what I mean by that is, like, when you're in classrooms, if you hear something that's said that doesn't sit right with you, speak up, like raise your hand and speak up. If you are, if you want to engage in research, but you don't know how, ask questions, reach out to your advisor, reach out to academic advising, or reach out to somebody, because we want you to do your research, because we know that you have so much to contribute. So I don't want, especially students, to feel intimidated or feel like it's too early to get involved in this. Susie from Hamlin has just volunteered herself. So if you're a Hamlin student, find Susie, find your outlets, find the people that are your mentors, and get involved. Like, you can do this work right now. We all have a role in this. It isn't something that's just going to get done by elected officials. We all as a collective have responsibilities. Obviously, I work right now trying to elect young women into office, because, I think that's part of our solution. And I also encourage anyone on this call, if you haven't already considered running for office and you feel that you are best equipped, if you're best, like, equipped and understand the needs of your community and you want to run for office, let me know. I can get you in contact with people, especially to the people of color and the young women and indigenous women on this call. Like, we oftentimes in our communities have been the leaders, have always led in ways that are deemed untraditional or otherwise. And I think it's important that we can also step up to be the political leaders that our communities need, and replace folks that haven't been leading. So, yeah.
Thanks, everyone. I see Susie's back, so I'm going to hand it off to you.
Thanks, Zach. And thank you so much for facilitating this conversation so generously, and to all of our panelists, thank you so much for your passion and the work that you're doing, and for the generosity of your advice today. I think there's a lot of people on this call that are really inspired and thinking really potentially differently than they were before this webinar. So originally I had planned that we would go to breakout rooms and then come back here. And I just, in sort of thinking that through in the moment, I'm going to change that up, and I'm going to conclude now and then send us to breakout rooms. We have a fair number of people still here with us that we really want to create a chance for you to connect with each other and to connect with our panelists. So I will put the link to the breakout room Zoom meeting in the chat in a second, but I wanted to just encourage you all to tap into the opportunities that the panelists mentioned, both specific organizations and pathways, but also think about in your own work how you can incorporate the brilliant advice that they've given us. We wanted to just, again, thank you all for joining us today. We want to leave you with the announcement that our next event is December 4th. It is titled Abolition and the Money Bail System, featuring Miriam Kaba, the nationally recognized community activist. And we have a stellar set of panels with representation from all over the Twin Cities. And we're really excited to highlight government, legal, and public health perspectives, and community activists and justice impacted members of our community. So stay tuned for more information about that. We'll be sharing that with everybody who was on the webinar today. Please consider following our social media accounts and our website to join our mailing list if you're not on it already, and to stay informed with all things that the Center for Justice and Law are doing. The students who are our CJL coordinators, including those who are part of this panel, host a weekly spotlight with someone in the community that they are inspired by. And so those have been really wonderful, and they live on after the event, so you can even go back and see some of the ones that have been taking place already if you're interested. And then if you are looking for a platform to uplift some of the community work you are doing in regards to public health and justice, just reach out to us and we'll find a way to incorporate your work into our programming and to support you as best we can. So I'm grateful to you all for joining us today. I'm going to put the link to the breakout rooms in the chat, and you can follow that link, and we'll see you in those breakout rooms shortly. And again, thank you to our panelists. Beautiful job.